Small intestine 1 at the ulnar nail point of the little finger. I'm going to feel for where the flare of the bone is. Look at where the nail bed is. Look at where the ulnar and the proximal borders meet. Put my point in, and there it is.
Small intestine 2 is on the ulnar aspect of the little finger in a flare just distal to the base of the proximal phalange in here. Small intestine 3 is on the ulnar aspect of the hand. It's in a depression which is proximal to the head of the fifth metacarpal. It's in between the metacarpal bone and the muscle, and it typically lays on a level with the distal palmar crease. Small intestine 4 is on the ulnar aspect of the hand in this nice depression between the base of the fifth metacarpal and the triquetral bone, which is this palpable bone on the ulnar aspect of the wrist. Small intestine 5 is on the ulnar aspect of the wrist in depression between the triquetral bone and the head of the ulna. The small intestine channel is starting to travel more dorsally, so you can find this point between two tendons that are running across the wrist joint. Small intestine 6 is located in a groove in the high point of the styloid process of the ulna. To find this groove, rotate the arm up onto the body. When you do this, you'll find that a tendon moves out of the way to reveal a nice groove in the bone. Be careful not to come too far radial or you will come off the bone completely. Actually find this point level with the high point of the styloid process, but in that groove.
Small intestine 7 is 5 cm proximal from small intestine 5 on a line connecting small intestine 5 to small intestine 8. Running my finger down between the anterior border of the ulna and flexor carpal ulnaris. Small intestine 8 is between the olecranon process and the medial epicondyle of the humerus. Make sure you don't have the arm fully flexed for this point because it will be impalpable.
Small intestine 9 is located on the posterior aspect of the shoulder, about 1 cm superior to the posterior axillary crease. How do you find this 1 cm? Well, it's important to place this point inferior to the inferior border of the deltoid. To bring this into relief, the person can push their arm backwards. You're feeling for a nice soft area below the muscle. It's important to remember that when you finally locate this point, you need to be completely parallel to the part of the body you're working on. Small intestine 9. Small intestine 10 is located on the posterior aspect of the shoulder. It's directly superior to the posterior axillary crease and inferior to the lateral extremity of the spine of the scapula. Find small intestine 9, come straight up, feel for the spine of the scapula, and then come back down into a nice dip to find this point. You're not on the bone, and you're not on the deltoid, you're in a nice dip. It's important to remember that to find this point accurately, you need to be standing parallel to the part of the body that you're working on. Small intestine 11 is found at the junction of the upper third and lower 2/3 of a line joining the midpoint of the inferior border of the spine of the scapula and the inferior angle of the scapula. It roughly makes an equilateral triangle with small intestine 9 and small intestine 10, but this is not always accurate. To find small intestine 11 accurately, you first need to identify all of these landmarks. To find the medial border of the spine of the scapula, place your hand on the back where you think the medial border might be. If it's not palpable, a slight amount of pressure on the shoulder will help to bring the medial aspect of the scapula into relief. To find the lateral extremity of the spine of the scapula, palpate along the spine until you find a bump at its end. Be careful not to go completely to the end of the shoulder. This is the end of the acromion process. It's not the end of the spine of the scapula. To find the inferior angle of the scapula, palpate down the medial border until you can find the scapula changing direction at its bottom. Once again, if this is not palpable, it may help for the person to put their arm behind their back. This will bring the angle, the inferior angle of the scapula, into relief. It's important to remember that once you've located it, you need to keep your finger on it as the person moves their hand back. Small intestine 12 is located directly superior to small intestine 11 in the suprascapular fossa. To find this fossa, palpate along the spine of the scapula and find this nice dip that lays superior to it. Once again, it's important that when you mark points on the shoulder, you're actually working parallel to the part of the body you're marking on. Small intestine 13 is located in a depression superior to the medial end of the spine of the scapula. It's about 1 cm medial and slightly inferior to small intestine 12. Palpate along the superior border of the spine of scapula until you find a nice dip at its medial end. Be careful that you don't palpate too far because you will fall off the scapula and find another dip, but it's not small intestine 13. Small intestine 14 is located 3 cm lateral to the inferior border of T1. Locate your T1, move 3 cm laterally. The 3 cm at this level is dictated by the medial border of the scapula. Small intestine 15 is located 2 cm lateral to the inferior border of C7. Locate your C7, use the medial border of the spine of scapula to dictate your 3 cm mark, move out 2 cm to find this point. Small intestine 16 is located on the lateral aspect of the neck on a contour with a laryngeal prominence. It's on the posterior border of the sternocleidomastoid. To find the posterior border of the sternocleidomastoid, have the person turn their head against resistance. You should then be able to palpate down the posterior border of the sternal body of the sternocleidomastoid. Have them relax their neck to find this point. It's posterior to large intestine 18. Small intestine 16. Small intestine 17 is located on the side of the neck, in between the sternocleidomastoid and the angle of the mandible. Palpate along the posterior and inferior borders of that mandible to make sure that you find the point where it changes direction. Don't just rely on where the flesh is changing direction. You need to be sure that you've actually found the angle. Mark your point in between the sternocleidomastoid and the angle of the mandible. It's in a nice depression. It's not on bone, it's not on muscle. It's in a depression in between the two. Small intestine 18 is located directly inferior to the outer canthus at the inferior border of the zygoma. It's best to find this point standing 3/4 of the face. When a person opens their jaw, a groove forms anterior to the tragus. Palpate into that groove and locate small intestine 19 in that groove anterior to the midpoint of the tragus.